Jumper's knee patellar tendinopathy is a load tolerance issue, but there are biomechanical factors that can decrease one's load tolerance and make it more likely that they develop patellar tendinopathy. A 2016 study, Peter Malieris was the lead author. They looked at 113 male and female volleyball players. They tested a bunch of things. They tested sit and reach flexibility, ankle dorsiflexion range, jump height, ankle plantar flexor strength, and years of volleyball competition and activity level. They found only reduced ankle dorsiflexion range was associated with patellar tendinopathy. They said ankle dorsiflexion and eccentric contraction of the calf muscle is important in absorbing lower limb force when landing from a jump. This is a biomechanical factor, having less ankle dorsiflexion range, that decreases one's load tolerance and makes it more likely that they develop patellar tendinopathy. A 2011 study by Bachman and Danielson, they looked at 90 junior elite basketball players examined over 1 year. At the end of it, they had 75 that met the inclusion criteria, and they had 12 athletes that developed patellar tendinopathy. The ones who developed it had less ankle dorsiflexion range than the healthy players. The cutoff was 36.5 degrees. If they had less than 36.5 degrees, they had a risk of 18.5 to 19.4% of developing patellar tendinopathy within a year. This compared to 1.8 to 2.1% for players with dorsiflexion range greater than 36.5 degrees. And there was a correlation with 2 or more ankle sprains and less ankle dorsiflexion range. They summed this up by saying this study clearly shows that low ankle dorsiflexion range is a risk factor for developing patellar tendinopathy in basketball players. So what should we do to fix this problem? Should we put a band around the ankle and just crank it into excessive dorsiflexion? I don't think that's going to happen. I think the Achilles tendon is too strong to allow that to happen. I think what's happening is whenever you have an injury, whenever you have an ankle sprain, that area doesn't work like it should unless you train it. The ankle and the brain are not connected. The ankle and the hips are not connected. If the ankle and the hips aren't working well, you're probably going to have more knee pain, put more stress on the knee. So the exercises that I'm doing there, the single leg stand, the isometric lunge, these are exercises I've recommended to hundreds of athletes, and they've resolved their knee pain. This is something Dr. Tommy John talks a lot about in his book. I've talked about it on my podcast with him as well, that these exercises are basic fundamental things that get an athlete back to normal human function, and when their ankle works like it should, the knee is probably going to feel better. So try it out and enjoy.